project that we are working on. Senator Miles, who is not here, has indicated to me that he would have you know that he is here in spirit. And I'm honored to stand for him, the representative for this area. This is the 9th Congressional District. This community accorded the opportunity to be tested. This coronavirus pandemic has highlighted the interconnectivity within humanity. More than 55,000 deaths in the United States alone. Although today we are here in Sunnyside, this is really bigger than Sunnyside. Because what happens in Sunnyside can impact the east, west, north, south sides. It can impact all sides. And the lesson that we must learn from this inescapable truth is that we must concern ourselves with what happens to others because it can happen to us. It would be a mistake to conclude that we should not dispatch with all deliberate speed the necessary resources to vulnerable communities such as Sunnyside simply because it's not where we reside. Where we reside is always important. But this pandemic has demonstrated to us that that which was birthed across the oceans can traverse the oceans, span the mountains, and find its way to Sunnyside, Texas. We cannot conclude that we should only concern ourselves with where we reside. We're all in this together, and we will all come out of this together. United, we can. Not just we stand, but united we can. United, we can have the testing. United, we can have the tracing. United, we can have the masking. United, we can bring this virus under control. But it does require unity, and I'm proud that this mayor has extended the hand of friendship across all of the lines that sometimes divide us and has brought us together so that we can impact this problem, this coronavirus. Finally, Mayor, I want you to know that your health department has worked closely with us. They've done an outstanding job, and I'm proud to thank them here today for this. Remember, dear friends, this is not about just Sunnyside. It's about every person on the planet Earth. I thank you, Mayor.
And told the testing has already started here at Sunnyside. I do also want to acknowledge Senator Boris Miles. He started early on calling and texting, wanting a site in Sunnyside and wanting a site right here at Worthing. So I want to acknowledge him, and representing him is his Chief of Staff, Camille Foster, and Kathy Blifford is also here. Camille.
Good afternoon. Senator Miles couldn't be here today. He had to be in the house. As you know, he had a kidney transplant, so he's a part of that group that would be affected adversely. But he was so excited last night when he got the call that this test facility would be here. He has been advocating and fighting for this from the beginning, fighting for testing facilities to be in the African American community because we are the community that is being hit most by this disease. It's important now more than ever, since the economy is starting to face back and reopen, that they get tested, that they know what they have, and if they do, they can be treated for it, and if they don't, that they can go ahead and go back to work and start their normal life. We can't stop. This is the first and the beginning, but he'll continue to fight for this and advocate for this. And again, he thanks Mayor Turner for listening to him. I know he's beat on his door and his phone often, Congressman Green, from the state to the local level. So this is important to him. He's very happy about this, but there's more that still needs to happen, and we'll continue to work. So just keep the faith and keep the fight. Thank you.
In your comments about beating on the door, he did more than that. I will tell you, I love you, my brother. I know you're watching, chill. At this point, before I call up Commissioner Ellis, let me call us Director Stephen Williams. He's just been very vital and instrumental in this whole process and helping to facilitate these testing sites And again,
Things typically don't happen without good leadership, good elected leadership. And so I want to express my gratitude to my boss, Mayor Turner, Councilmember Shabaz, Senator Miles. You're right, he texted and called us a lot. Congressman Algreen, I want to acknowledge him because he actually, on one of our first weekends, we were running out of supplies at Butler. He was able to help us access some masks. So I'm grateful for that help. HISD board member, Kathy Buford, thank you for your participation in this. And County Commissioner Rodney Ellis, I get phone calls from him too, Matt, although I work for you. On Monday, I joined Mayor Turner and other elected officials in opening up a very similar site in the southeast. That site, as well as this site, have one goal, and that goal is really to provide resources, testing to vulnerable communities. We know that COVID-19 is an equal opportunity virus. We know that there are certain people that will experience more serious outcomes if they are affected with the virus. That includes people that are 65 and older with underlying health conditions like diabetes, obesity, sickle cell, lupus, cancer, and other conditions. And so it is very important for us to really provide testing, in this case, and access to these vulnerable communities. People can visit HoustonEmergency.com for a list of places to get tested, and HoustonEmergency.com. As a health department, I'm grateful to my staff for being willing to answer the challenge related to COVID-19, and we commit every day to the challenges related to COVID-19. We will continue to do outreach in vulnerable communities and provide access via mobile sites or fixed sites.
and of course, Dr. Purser, who's working right alongside Director Williams in all of this.
Thank you, Mayor. And I'd like to thank all the elected officials here because they've all contributed through this entire event. Elected officials have come together and been there when we needed them. As pointed out by the mayor and Director Williams, we're getting phone calls from elected officials, but don't think that we haven't called them and asked for help, but they've been there for us. So to all the elected officials, thank you so much for your help. And Mayor, I'd also like to thank you for pointing out the hard work of the members of the health department. So I wear two hats in the city of Houston. I'm the EMS medical director and I'm also the public health authority. So in my role within the fire department, I have for many, many years, seeing that first responders are recognized for how they go in to put their lives on the line, put themselves in the line of fire sometimes with what they do. In my last 16 years of the health department, I've come to recognize that those folks who go out and deal with people who have infectious diseases in particular are also putting themselves in the line. But the health department workers, those people that go out in the street day after day, sometimes don't always get the same attention. So I want to thank you for pointing that out because Marlene and Capricia here represent a growing army of folks that we need to battle this really difficult problem with the coronavirus. On Monday, I gave an example of how a virus started a domino effect of cases from the Egyptian river cruise. And in that, I talked about a traveler from Taiwan who, at that point, we thought was the index case. And I want to thank, make sure I get the name right here. I want to thank the Deputy Director Chang from the Taipei Economic Cultural Office of Houston, who emailed me last night with some interesting information which we didn't have before, at least I didn't have before. And that was that some genetic sequencing research was done on that case. And it was determined that there is a high probability that that case was not infected in Taiwan, but rather was actually infected in Egypt. And so that was new information, but it really underscores the point that I was trying to get across, was that with this virus being able to infect people without causing them to have symptoms, but allowing them to then spread the virus, we all need to have our guard up. We cannot drop our guard. And in that example, I pointed out how the people that are on that river cruise, and we've seen this with other cruise ships, the cruise environment is one which is really conducive to viruses. We've seen this for many, many years. Set up a domino effect where a large number of folks got infected. So it doesn't really matter who was the index case. The point is that any one individual, if infected and not knowing it. So this is why testing centers like this are so very, very important. So if people think that they have symptoms and think that they may be infected, they absolutely should take advantage of one of the many, many sites that we have available today. And now we're actually getting the testing sites out into those neighborhoods which traditionally don't have access to healthcare. And I can't underscore how important that is. So again, thank you to everyone who has facilitated that. And for those of you who come and get tested, an important reason for you to get tested is that if you should be positive, and I've said this the last couple of days, that then empowers you to protect your families. And just ironically, just yesterday, the New England Journal published an article, and it's a little bit small, but it talked about the amount of spread within a household if an individual is infected, and how that spreads within the people in their own home. So the people that we all care about most are our family members. So it turns out that on average, 16% of the people in a household would become infected by one person who was infected and didn't quarantine. But if they quarantined themselves, it dropped to 0. And not ironically, but they looked at which member of the household, and of course adults spread it to adults more than they spread it to their children, and spouses spread to spouses on nearly 30% of the time. So I want to make sure that people understand the value of how you become empowered to protect the people most important to you when you get tested. And then the other thing I want to point out is that we are seeing something. I'm going back to my emergency medicine EMS hat. We are noticing within the Houston Fire Department, we're noticing a decrease in our total call volume. It's down about 20% since the beginning of this whole thing. But more concerning to me, as we look at the data, most of those seem to be the non-emergent calls have dropped off. But more concerning to me is that we are seeing a slight decrease in the number of heart attacks that people are calling 911 for, as well as strokes. And so one thing about this coming out, has been in the media about this virus, is it does seem to affect the blood and cause clotting, and clots can cause heart attacks and cause strokes. So ladies and gentlemen, if you think you're having the signs and symptoms of a heart attack, or you think you're having the signs and symptoms of a stroke, you need to call. There's another article that was published actually just yesterday. It was a series of only 5 patients who had had strokes. They were all infected with the COVID virus. They were all less than 50 years old. And the lead article was of a young woman who had a stroke. She had developed difficulty speaking. She developed weakness in her arm and leg. And she didn't go to the hospital because she was afraid that she would catch the virus if she went to the hospital, because she didn't know that she was already infected. And so again, this virus is insidious. Please come to these sites to get tested. Take advantage of the testing that all the people back here work so hard to put together for you so that you can protect yourself and your family. If you do that, you know, Houston has done really, really well when we compare ourselves to New York and New Orleans in particular. It's because people are doing the right things. Let's keep it up. The folks behind me are doing what they can to get the testing sites up. Y'all need to take advantage of it so you can take care of yourselves and your families.